Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Before start my presentation, let me introduce myself. My name is Yunita Indah. I'd like to give a presentation about multiple birds. I will begin by explaining the definition about multiple births or pregnancy. A multiple pregnancy is a pregnancy where you are carrying more than one baby at a time. If you are carrying two babies, they are called twins. The babies that are carried during one pregnancy are called triples. You can also carry more than 3 babies at one time or high order multiples. Let's move on to the next slide is discussion point. And I have 5 important points in this material. Number 1 is how to multiple pregnancy happen. Number 2 is what increases the chance of a multiple pregnancy. Number 3, how common are multiple births. Number 4 is what are the signs of a multiple pregnancy. And the last is what complications are linked to multiple births. For the next slide is point 1. How do multiple pregnancy happen? There are two main ways that a multiple pregnancy can happen. One is one fertilized egg or ovum splits before it implants in the uterine lining, and two or more separate eggs are fertilized by different sperm at the same time. For the next slide is point 2. What increases the chance of a multiple pregnancy? There are several factors that can increase the risk of a multiple birth. You might be at a higher risk of getting pregnant with more than one baby at a time if you are older, or women in their 30s are at a higher risk of a multiple because their body start to realize multiple eggs at one time when you get older, and are a twin yourself or have twins in your family. And the last are using fertility drugs. You might also be at a higher risk of a multiple pregnancy if you are taller than average or have a higher body weight. Okay, let's move on to the next slide. Is how common are multiple births? Multiple births have become more common in recent years because more people are using fertility drugs and producers such as in vitro fertilization or IVF to help conceive a baby. For the next slide is point 4. What are the signs of a multiple pregnancy? Maybe the only way to know if you are pregnant with more than one baby during your pregnancy is through an ultrasound exam with your healthcare provider. During this test, your provider can look at images of the inside of your uterus and confirm how many babies are in there. You might experience more intense symptoms during a multiple pregnancy than with a single pregnancy. This can include severe nausea and vomiting or morning sickness, a rapid weight gain in the first trimester of pregnancy, sore or very tender breast, high human chorionic gonadotropin or HCG levels. This hormone is made during pregnancy and is what a pregnancy test pick up. And the last, high amounts of the protein alpha fetoprotein in your blood. In the last point is number 5. What complications are linked to multiple births? Anyone can experience complications during pregnancy or regardless of how many babies you're carrying. However, most healthcare providers consider multiple pregnancies high risk than single pregnancies, and possible complications include is number one, premature labor and birth. Number two, preeclampsia or gestational hypertension or high blood. And the last is number three, fetal growth regression. For this slide, maybe question that might arise from many people. Question number one, what can I do to stay healthy during a multiple pregnancy? Maybe eating nutrition foods, getting enough rest, and visiting the doctor regularly are important steps for any pregnant woman to take toward a healthy pregnancy. These steps are especially important during multiple pregnancy. For the question number two, can I be active and exercise during a multiple pregnancy? Exercise and activity is an important part of any pregnancy. In most cases, you can absolutely exercise during a multiple pregnancy. Low impact exercise are a great way to stay in shape and maintain your health throughout pregnancy. Same low impact exercise to try during a multiple pregnancy can include swimming, walking, prenatal yoga. Even touch activity is wonderful during pregnancy. You should talk to your healthcare provider about the best activities for you. Some more strenuous activities might not be a good idea during a multiple pregnancy, including jogging, aerobics that involve jumping. It's also important to remember that your exercise routine might need to change over time if you experience any complication. Okay, for the last slide is conclusion. I'd like to conclude my presentation is what we learn about multiple births is that we know how to process of multiple births occurs. What possibilities occur when we are in a state of multiple births, and from all the material that I present on the association, I took reference from the link search. That's all from my presentation. I apologize for the mistakes. And thank you everyone. Wassalamualaikum warahmatullahi wabarakatuh.